Hace unos días YouTube me censuró un video en el que hablaba de la Great Barrington Declaration, esta iniciativa que ha generado bastante impacto a nivel mundial y alguna controversia, de profesores de Harvard, de Stanford y de la Universidad de Oxford, máximos epidemiólogos del mundo o de las máximas autoridades en esa materia en nuestro planeta, en la cual ellos sostenían que las cuarentenas no eran la forma de enfrentar el coronavirus. YouTube sostuvo en su cancelación de mi video que podía entenderse a partir de él que las personas debían desafiar o no cumplir con las reglas que la autoridad local o la Organización Mundial de la Salud establecen para el combate de la pandemia. Jamás fue la intención en ese video promover a que las personas no cumplieran con la normativa establecida por los gobiernos. Y voy a insistir ahora que hay que seguir las reglas que los gobiernos establecen para combatir las pandemias. Eso no significa, sin embargo, que debamos aceptarlas de manera completamente acrítica y que no vamos a reflexionar en torno a si las políticas que los gobiernos están siguiendo son las más apropiadas para combatir la pandemia o no, especialmente teniendo en cuenta que el mayor costo lo asumen los ciudadanos, tanto en términos de su libertad como de su actividad laboral, económica e incluso salud personal en muchos casos. Entonces, esto lo digo porque en el video que sigue a continuación yo entrevisté a Martin Kulldorff, profesor de la Universidad de Harvard, un experto en epidemiología, una de las grandes autoridades, una eminencia mundial en esta materia, que fue uno de los autores de la Great Barrington Declaration. Y con él conversé sobre cuál es la perspectiva que tiene tanto él como la comunidad de científicos que son expertos en enfermedades infecciosas respecto a cuál es el camino que deberán seguir los gobiernos. Es una contribución que pretendo hacer al diálogo racional, al debate basado en evidencia científica con uno de los mejores expertos del mundo, y espero que YouTube esta vez no lo censure. Hay otras entrevistas de Martin Kulldorff y de sus colegas disponibles en el mismo YouTube, y quiero insistir una vez más que no es la idea que la gente entienda que no hay que cumplir con las normativas establecidas por el gobierno. Al revés, hay que cumplir con esas normativas, pero eso no significa que necesariamente estas normativas no puedan ser mejoradas o criticadas desde una perspectiva con asidero científico, como es el caso de lo que han hecho los autores de la Great Barrington Declaration, entre ellos Martin Kulldorff. Los invito también, antes de terminar esta introducción, esperando que YouTube no la censure, a ver la siguiente entrevista en la que David Navarro, el delegado especial de la OMS, la Organización Mundial de la Salud, para combatir la pandemia del COVID, sostiene él, en línea con la Great Barrington Declaration, que la Organización Mundial de la Salud nunca ha recomendado como primera medida para combatir la pandemia las cuarentenas totales, y hace un llamado a los gobiernos del mundo, esta es la Organización Mundial de la Salud, a no seguir aplicando estas cuarentenas como se ha venido haciendo hasta ahora. Los dejo con esta entrevista de Spectator TV, donde el delegado especial de la Organización Mundial de la Salud para la lucha contra el COVID afirma, estando de acuerdo con uno de los precursores de la Great Barrington Declaration, que cita textual en ese video, que las cuarentenas totales no son la forma para combatir la pandemia. Esta es la Organización Mundial de la Salud, y espero que YouTube tome en cuenta eso antes de analizar si este video cumple o no con sus directrices, porque evidentemente cumple con las directrices de la OMS. Se trata de una conversación con uno de los más grandes expertos del mundo en una sociedad democrática en la cual tenemos que tener derecho a discutir sobre las políticas que adoptan los gobiernos, sin necesariamente desobedecerlas, pero sí a discutir sobre ellas, sobre todo cuando se trata de un asunto tan delicado como nuestra libertad y la prosperidad, que puede terminar siendo truncada por políticas adoptadas desde un punto de vista científico no fundado o incompleto. Así que los dejo con esta entrevista y por supuesto también los invito a suscribirse a este canal de YouTube, a comentar esta entrevista, pero antes, insisto, la intervención del doctor David Navarro de la Organización Mundial de la Salud, para que no queden dudas de que la posición hoy de la OMS se alinea con la de Martin Kulldorff y la Great Barrington Declaration que yo voy a elaborar a continuación en esa conversación que tengo con el profesor de Harvard.
Really important point by Professor Gupta. I want to say it again. We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. The only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it.
Nos encontramos con Martin Kulldorff, que es un eminente especialista en materia de epidemiología. Él es profesor en la Universidad de Harvard. Es una persona que se ha hecho muy conocida en poco tiempo, yo diría, más allá de los círculos propiamente académicos y especialistas, por haber sido uno de los precursores de una declaración conocida como la Great Barrington Declaration, en la cual se plantean puntos de vista un tanto distintos de lo que normalmente se suele ver en la discusión pública en los medios de comunicación, no solamente en Europa, Estados Unidos, sino también en América Latina. Pero me gustaría, Martín, usted habla perfecto español o habla muy bien español. ¿Dónde aprendió el español que maneja? Porque usted es originario de Suecia, pero vive en Boston, es profesor en Harvard. ¿Cómo sabe español? Eso no es muy común.
Es un gran placer hablar con usted. Yo aprendí español en Guatemala. Viví en Guatemala por medio año trabajando con un grupo de derechos humanos.
Ah, qué bien. Nosotros tenemos buenos amigos ahí en la Universidad Francisco Marroquín en Guatemala. La conozco muy bien el país. Bueno,
Sí.
voy a cambiar a inglés para poder entrar en la dimensión más técnica de la discusión. Nosotros
Gracias.
podemos ponerle después algunos subtítulos al video para que se entienda mejor. Thank you very much, Professor, for being with us.
Thank you.
And taking some time for the Latin American public and the Spanish-speaking public here in Latin America to know more about your thinking about what is going on in the world with the COVID-19. And could you, as an introduction, maybe explain to us what you have been doing over the last years, like what exactly is it what you do, and then what's your position on the current situation regarding COVID?
So before COVID-19, I worked a lot with infectious disease outbreaks and developing epidemiological methods for how to quickly detect new infectious disease outbreaks and then how to monitor them as they are occurring. So that's something that I've been involved with for several decades, and the methods of that are used by health agencies around the world. I've also worked a long time with this monitoring the safety of vaccines. So after a vaccine is on the market, we want to monitor the safety when it's given to the population. So it's called post-market surveillance. So I've been working with that for a long time as well.
So you are then, if I can sum up this, you are a specialist on, let's say, infectious diseases, and then also the development of vaccines, basically.
Yeah, not the development of vaccines, but how to do surveillance, disease surveillance, to monitor diseases.
Okay, so you and other colleagues decided to issue a very interesting and also to some extent controversial for some people declaration that was called the Great Barrington Declaration. Why did you and your colleagues decide to, or thought it was necessary to issue a statement about the way governments around the world are handling this COVID crisis?
Well, there are two basic principles of public health. And actually, if we had written this statement a year ago, I don't think it would have been controversial at all, because it's based on all basic public health practice, and it's very similar to the various pandemic preparedness plans that different countries have prepared ahead of time, because we knew we were going to get a pandemic sooner or later. So a key feature of COVID-19 is that anybody can be infected, young or old. The risk for mortality is much higher for older people. And most people know that, but they don't think they realize the enormous difference in risk, because it's not that they're twice the risk, or 5 times, even 10 times the risk. It's not even 100 times the risk. The difference in risk for mortality is more than 1,000-fold higher among the older versus the younger. So among older people, COVID-19 is a very dangerous disease, and much worse than the annual influenza. On the other hand, for children at the other spectrum, it's a very mild disease, most asymptomatic or just mildly symptomatic, and it's much less dangerous than the annual flu. So there's this enormous difference, and what governments has been doing, they've thrown away two basic public health principles. One is you can never look at one disease alone. You also always have to look health as a whole. So you have to look not only at COVID-19, but also at the collateral damage that's caused by these lockdowns, by school closings, etc. And the other thing is you can't look at it in short term. Right. You have to look at it in the long term. Now, if you're a medical doctor and you have a cancer patient, you want to look at it short term because you want to prolong the life for maybe a year, because that's very important. They can spend one more year with their family and grandchildren and so on. But in a public health setting, to postpone a pandemic for a year doesn't make sense, because while some might live a little bit longer, others are going to go in a higher risk group and will then die prematurely rather than surviving the pandemic. So what the lockdowns do is postpone to the future. And that makes it much more difficult for older people to protect themselves, because instead of self-isolating for a few months, they might must know how to do it for over a year, and that makes it much more difficult. So I think these two principles were forgotten for some reason with COVID-19 and just thrown out the window.
You have a theory about why that was the case? Why is it that we forgot about these two basic principles of public health?
No, I don't. It's puzzling and stunning. There was a desire to flatten the curve in the beginning, and that makes sense because we don't want to overburden the hospitals. Right. So that was very logical and consensus among epidemiologists. But then somehow it morphed into a desire to eliminate every short-term case by doing lockdowns that has this enormous collateral damage. If you do it for a few weeks, that doesn't have too much collateral damage. But if you keep doing it for month after month, with school closings, for example, that's very detrimental to children, and not just the education, but also the physical health and the mental health.
Could you elaborate a little more on the side effects of these lockdowns, very strict lockdowns in terms of public health? Because this is something that is really overlooked in the public debate. It looks like the only health problem we have in the world is COVID, and all the other things do not exist, and we are not going to pay any price for having this lockdown. So could you maybe elaborate a little bit on what sort of cost are we going to pay because of these very strict lockdowns that some countries have implemented?
So actually, yesterday I looked at the graph of one of my colleagues who had looked at visits to doctor visits and how that has plummeted in the spring, and it's got a little bit back up in the US, but not very much. It's still very low. And people don't go to the doctors for the fun of it. People go to the doctors because they need help with something, they're sick and it get better, or they need to have some preventive care to deal with their diabetes or their heart problems, or they go there for a cancer screening. to make sure that cancers are detected early. So we're not going to the doctors for the fun of it. So every of those doctor's visits will have severe consequences down the road. And if we, for example, take cancers, there's much less diagnosis of cancer now. It's not because people don't have cancer, it's because it's diagnosed. So maybe somebody who would have lived for another 15, 20 years if they've had the cervical cancer screening is now maybe going to die 2 or 3 years from now. And those are not things that we see in the statistics right now. But there's something we're going to have to live with for a long time. And the longer we prolong the lockdown, the worse these issues are going to be.
You think there is a risk in some countries that maybe public health systems or hospitals, whatever, could at some point in the future even collapse or not be able to deal with these other diseases that we are not dealing now, that we are not dealing now because of the lockdowns? Or do you don't see that as a potential risk? Like this problem?
I don't. It will increase the burden maybe, but I don't think it's going to be so focused in time. It's going to be spread out in time. Yeah. So for example, cancers, it's not going to all happen the same month.
Right.
It will be spread out over many years. So that in that sense, it's different from the pandemic where everything happened in the spring, very concentrated in time. And that's why we had to flatten the curve. But that's not, I don't see those issues with the other diseases. That's going to be more spread out over time.
Right. But at some point, it will also increase the cost for the public health sector to deal with these things.
Yes. Yeah.
So we'll have to invest more resources. Right. So what about the children who are not being vaccinated? Is that a reason for a big concern, or is that not very a big problem because we could do it at some other point in the future? I'm asking like a real lay person who do not know a lot about this.
Yeah, so it is a concern because, for example, measles is a very serious disease for children. They are death. There was an outbreak last year in Samoa where there were a number of children who died. And children can go blind also. So that's a major concern. Now, as long as the physical distances and those things are in place, you're not going to see an outbreak of measles because that social distancing or physical distances that people are doing for COVID also reduces the spread of other infectious diseases. So I don't expect anything very immediate problems with it. But once things go back to normal, which will happen one day, then we're going to have less kids vaccinated, and then we won't have the herd immunity that's sort of keeping measles in bay. So there might be outbreaks of measles or other childhood diseases like pertussis. So it's important that we sort of get back on track and get all the kids vaccinated the way they should be before too long.
If we continue these lockdown policies, and some people are already thinking about it in Europe with the second wave and things, you think in the end we are going to pay in terms of public health and lives lost a bigger, we will have incurred in a higher cost in terms of lives and lives of people and public health than if we had not introduced the lockdowns in the first place? Like, are the lockdowns going to save people really, or in the end, netto, are they going to cost lives? I mean, can we make an assessment like that?
I think it will cost lives in the end.
Right.
And so what we have to do is focus protection, because the older people, we have to do a much better job protecting the elderly. So we have to have more testing in nursing homes, both for staff and visitors, less staff rotation in nursing homes. People who are in their 60s and above, we should try to make it possible that if they cannot work from home, that there's some in US Social Security, for example, that can be used to let them have a sabbatical during times of high transmission so that they can stay safe, and so on. And then the longer we drag out the pandemic, the harder it is to protect those older, vulnerable people. And then we should let younger people, children go to school, students go to universities, and young adults should live normal lives. And that will reduce the collateral damage of this pandemic.
And one country that comes into this debate all the time is your home country, Sweden.
Yes.
It looks like Sweden was right in the end. And some, if you read even the New York Times and other newspapers now are saying it was vilified at the beginning, but now it looks like they got it right. Would you agree with that? And what's the view in your profession among epidemiologists regarding Sweden? Is there a consensus, along these lines, or is it a split opinion? What's the common view, among specialists?
So back in April, Sweden was vilified by the international media, and I was terrified that Sweden going to buckle and follow the rest of the world. So at that time, since I write Swedish, I published 3 op-eds in the major daily newspapers in Sweden defending the approach that they were taking, because I figured they needed some outside support and defense. And I'm very glad that they did continue to pursue what they were doing and not closing this. So schools were open, for example, and so on. I think both journalists and scientists, so those who agree with me, which is actually the majority of my colleagues who are infectious disease technologists, they look to Sweden as a role model.
Yeah.
But scientists in other fields who have in the past been very critical of Sweden, I think they feel uncomfortable now and don't quite know how to deal with Sweden, as well as journalists and newspapers who are vilifying Sweden are now uncomfortable and don't really know how to deal with Sweden.
So it's very strange that people who are specialists on these infectious diseases mostly got it right, and they thought Sweden, if I understand you correctly, Sweden was the right approach, even though they made some mistakes that could have been avoided. But how come that if most specialists like yourself and others who know about this issue, infectious diseases, believe that, then we had the mainstream media, and then we had also other scientists who are not specialists on infectious diseases, saying the complete opposite and then even dominating the narrative. You have also theory about this. What happened? Do you need to develop better communication, systems, so we can prevent these things from happening, or what's your view on this?
So in Sweden, among my infectious disease ethnology colleagues there was almost complete consensus to support the approach. There was one who were against it, and very vocally so, Professor Olsen at Uppsala. But I think that was an exception. So other academics in Sweden who were against it were from other fields. In the United States, it was actually more mixed. So there were some who were proposing the lockdowns. And for example, Neil Ferguson at Imperial College was one of the early proponents of a lockdown, while, for example, Suneta Gupta at Oxford, who is, in my view, the preeminent infectious disease technology in the world, she was ignored. And she's one of the co-signers of the Great Barrington Declaration with me and Jai Bhattacharya at Stanford. So she was essentially ignored. I tried to publish in both the popular and scientific media in the US, and I failed. I had no problem publishing in Sweden, but I failed in the US. And it's not until very recently that there has been more of an interest among the public about what we have had to say. So that's sort of the history from my experience. Why that is, I'm absolutely stunned. And I think it reflects badly on the scientific community And I think it's resulting and continue to result in a lot of a lack of trust among the public in the scientists and science, and actually rightly so, I think. But in the scientific community, we're going to have a lot of work after this. Now the priority is to get through the pandemic with as few deaths as possible. But when that's done, we have a lot of work to try to restore the proper functioning of science, scientific community, and to restore the trust in science.
Right. Now moving to the vaccine debate, how hopeful can we be, about a vaccine? There are some rumors that now in November or December we will have a vaccine. Is that like the magic bullet? Is that the thing that's going to solve everything, and then we don't have to worry anymore about this? Because many people believe that.
I don't dare to make guesses. What I usually say is that we'll have a vaccine sometime between 2 months from now and never.
And never. Well, how is can you elaborate on that?
So there are several. So first of all, I have enormous admiration for the scientists who are working on vaccine development. I think they are working very hard, and they are having new, interesting ideas. There are a couple of dozen different vaccines that are in the pipeline. Most of those are not going to work. That I'm convinced of. But hopefully there will be at least one, maybe 2 or 3 that will work, that have both efficacy and safety. But it's very, very hard to predict those things. And even if we have a vaccine that will be approved, maybe it's only 50% effective.
Yeah.
The flu vaccines, for example, if a flu vaccine is 50% effective, it's a good year for the flu vaccine. So, so even that's not going to be the magic bullet then to solve everything. If we get a vaccine that's just as good as the measles vaccines, then yes, that will be a magic bullet. But what kind of vaccines we get, when we get it, if we get it, is up in the air. And I think that we can't sort of do our strategy thinking that 2 months from now we're going to have a magic solutions. And doing this focused protections, I think we have to do that whether or not we have a vaccine soon, because even if we have a vaccine soon, we have to protect the elderly as best we can until we have a vaccine. And even if we have a vaccine soon, we need to get kids back into school, because school is so important. They have already lost too much school time. It's okay to do it for a few weeks, but to continually not having the children in school is so damaging both to their education and their physical and mental health, that we need to get them back into school, whether or not we have a vaccine soon or later.
Do you and then believe in the theory that was, or I assume you don't believe in this theory, but many people fear that children are very active in, spreading the disease, that children are vectors and are infecting everyone, or that you should isolate them from older people and sometimes their grandparents and things like this. So how dangerous are children, not in the sense that they are going to be affected by the virus, because you already said they are not really at risk, when they get the COVID-19, but what about other people being in contact with the children?
Yeah, so for influenza, children are major spreaders, and schools are hotbed of transmission of influenza. And that's why we, for example, have vaccination of children to limit the spread of the disease. But COVID-19 is very different, and the children are not the major spreaders of the disease. And we know that from a few different things. One is Sweden that kept the schools open. That was the only major Western country who kept the schools open throughout the height of the pandemic for ages 1 to 15. And not only were there 0 deaths among the children and only a few hospitalizations, but when looking at teachers, they had the same risk of COVID-19 as the average of other professions. And among those other professions, many of those were people working at home. So if you only compare it to the teachers to those other professions where they actually went to a work site, the teachers were actually at less risk than those other professions. So that wouldn't happen if children were major spreaders. So they are not from that data. And we can also look at this a very interesting study from Iceland, because they did a huge survey among a big proportion of the Icelandic population. And they looked at the genetics of the virus. And by that, they could see who infected whom. And they could see that it's very common for parents to infect children, but there was very much less infection from the child to the parent. So all these things together shows that the children, well, they can be infected, and most of them are asymptomatic or mildly symptomatic, but they are not the major source of transmission for this disease.
So you have
in a school setting, I think if teachers are in their 60s, they have to be careful, more so from the fellow teachers than from the kids. But I think for teachers older than 60, we should have something in place that they can work from home, either doing online teaching or helping other teachers with grading exams or homework. But other than that, the school should be open for the children for in-person teaching. And I don't know what the situation is in Chile about the schools, but...
So they're still closed, and that was one of the things that was very harsh in Chile, the lockdown. So you were not even allowed to go on the streets for a walk unless you had a special permit. So we were locked down for months in our houses. And if you had a special permit, you could go, I think, twice a week to the supermarket or whatever to get some groceries, and that was it. So other than that, you had to stay at home. And of course, there were many economic effects and things that were devastating. And this is very important, and that's why this conversation is very important, because in Latin America, Chile is regarded or used to be seen as one of the countries who that did deal relatively well with the pandemic. But I'm not so sure about that. And we don't have any hard evidence that these quarantines for months and months really had positive net effects. So, but we might have again the problem next year when we're entering winter, and the authorities have to decide what to do. So your advice to the Chilean authorities, like to all authorities, maybe would be like this strategy you call focus protection. Could you mention some of the measures? You already mentioned one, but that you would follow or apply in order to protect the vulnerable people, or what should we do from a health policy perspective? Like, can the rest of us just have a normal life, and what should we do about those who are at high risk?
So for the high risk, the older people are high risk groups. For nursing homes and other care settings, do more testing of staff and visitors, frequent testing, and that's available now. It wasn't in the spring, but that's available now. And if you want to visit your grandmother and you happen to be positive, then postpone the visit for 3 weeks.
Right.
Let a cousin visit her instead. For people who older people who live at home, where maybe by themselves or with a spouse, they should have help with the grocery shopping so they don't have to expose themselves. They should still be outside to get fresh air and those things. And obviously they want to see family and friends, but they should avoid big gatherings and things like supermarket as much as they can during the height of the transmission.
Yeah.
People who are still in their 60s and working, I think the government should allow them to take, using retirement funds to take a sabbatical for a few months so they can stay home and protect themselves during the height of the transmission. And the most difficult things are the multi-generational homes. And actually I had that situation with my family, which we sort of managed to solve with some creative thinking. But so for example, if you're an old person living with your son or a daughter who is working age, then maybe you can live with a sibling for a while, for a couple of months, or with a friend, so that you can isolate with them who doesn't have to be out in the working age. And if that's not possible, maybe empty hotel rooms can be used for them.
Right, and this you mean it's as long as we are in that phase where the virus is spreading faster. Let's say, is that in winter, or is it true that in the summer we have less contagion than in the winter? Or
I think it's different in different places. So, for example, Florida had it in the summer,
right?
Even though it's in the northern hemisphere. So I don't know how it operates in Chile, and it could be you have a very long country from north to south.
Yeah.
So it could very well be that it's very different in the north versus the south in your country, and therefore the measures have to be very localized.
So, but the overall approach of herd immunity would mean, for instance, could be reopen restaurants at a normal capacity, working capacity, or movie theaters, or let's say, could soccer fans go to the stadium and watch like 70,000 people in a stadium watching a soccer game, or that would be too much?
I think for children should go to school in person teaching, and young people should live normal lives. So you look quite young, so if you want to go to the bar and have a beer with your friends, I think you should do that. But don't bring your grandfather with you. Right. He should not be there.
So one of the last questions, if we had to take an average of the fatality rate of COVID-19 and compare that, I know you said it's very different, it depends on the age groups, and it's very, very different. But still, if we had to take an average, how much more dangerous it is or lethal it is compared to other forms of influenza that we have been dealing with for years already, like in terms of an average affecting the population?
So I think on average, COVID-19 is worse than a typical influenza year. That might be different in some countries which have a younger population, a very young population.
Right.
But certainly in the US, I think COVID-19 is worse than a typical, even a bad influenza year. On the other hand, it's not as bad as the 1918 pandemic. That was worse than the one we have now. That also affected young people a lot, including children and young adults.
So what do you think is going to happen next? Do you have an idea? And this would be my final question. In Europe, you have a second wave. In some countries, people are starting to get paranoid. I have family living there. They're telling me they're thinking already about, closing things down. You think your voice, your ideas, and I mean, it's not only your ideas, it's the scientific community you belong to, who are experts on infectious diseases, are having more influence, are reaching an increasing influence? Is it the governments are going to listen to you more now because they know also economically it's not really viable to sustain these lockdowns for a long time, and they will have other sorts of political even problems if they do that? Like, how do you envision the next 6 months? What do you think is going to happen?
So I'm a simple public health scientist, and you're asking me a question about psychology, sociology, and politics. So you might know that better than I do. We're trying as best we can to say what we think is the best solution. And you're right, this is not my idea. There are many of my scientific colleagues who have been arguing for this since back in March. So it's certainly not something that I claim is my idea or anything. And it's also what's in many of those pandemic plans from before COVID-19. My guess is that the change is not going to come directly from the politicians. I think the change will come from people who will be putting pressure on the politicians. And with that, there's an expression, if there's an expression, if the people lead, the leaders will follow. Yeah, and I think that might be the case in this situation, because they are already, they have already sort of vetted to the policies that they did implement. So it might be hard for them to acknowledge that wasn't the best approach.
And
that's psychology, which I don't know very much about. So
yeah, I was curious to know if you have a feeling, maybe a perception that your voice and the voice of your colleagues is being taken more seriously by the media and the politicians. I have this perception that the media is sort of starting to speak positively about Sweden and saying, you know, maybe this was the way to go. So that's what I was like trying to get at.
There's been a huge difference in the last month or even the last couple of weeks in the public discourse about this. Right. It used to be that media was claiming that the science community, falsely claiming, in my view, that the scientific community were in consensus with lockdown and contact tracing and those things. And I think it's now clear to everyone that no, there is no such consensus, and there never was such consensus from the scientific community. So I think that realization is coming, is becoming more clear now, and I think that's a good first step.
Well, on that note, Professor Kulldorff, muchas gracias.
Muchas gracias a usted, un gran placer hablar con usted.
No, encantado, y esperamos que esta conversación y la entrevista que será publicada contribuya a cambiar el discurso público para que adoptemos una estrategia más parecida a la de Suecia y no los lockdowns tan estrictos, porque Argentina, Chile, Perú, muchos países en América Latina aplicaron lockdowns brutales, muy fuertes, que restringieron mucho las libertades. Así que esta discusión creo que va a tener mucho impacto y mucha influencia en cambiar un poco la visión que predomina en el discurso público acá en América Latina. Así que muchas gracias por eso.
Gracias a usted. Hoy hay una canción muy famosa que estaba escrito en Suecia, mi país, pero que es mucho más famoso en Chile. Y esta es la canción Todo Cambia.
Ah, sí.
Y esperamos que en esta cosa todo va a cambiar.
Esperamos que sí. Muchas gracias, profesor Kulldorff. Muchas gracias.
Sí, chao.
Hasta luego.